Big Pharma, health insurance prejudice, the monopoly of the American Medical Association, media cover-up. You want the truth? Well, so does he. Coming straight from his holistic healthcare center in Warren, Ohio, it is your health seeker, Dr. William Schneider. He is not your average doctor. He is a holistic physician. He has a degree in nutrition, chiropractic, and acupuncture. He has specialized training in applied kinesiology, functional medicine, and more. He is coming you today to expose the truth behind the commonly misunderstood and incorrect treatment of disc problems. He will provide you with an education and restore your ability to be in control of your health care. Regain the power to take charge of your life. Decision-making back in your hands, right where it belongs. You see, there are things you need to know about degenerative, bulging, and herniated discs. The issue making this part of your body so easily injured is the fact that after the age of 2, the blood supply to the disc degenerates. That's right. There is no blood supply to the disc after that time. From that age on, the only way the disc gets fluid and nutrients is with movement. So falls, traumas, injuries, improper bending, and poor posture can adversely affect the disc. The muscles, ligaments, and tissues surrounding the disc can develop adhesions, scar tissue, which can result in a reduction of normal movement and function. Loss of the normal movement to any one or several segments of the spine will result in less fluid entering the disc, which causes dehydration, degeneration, bulging, and herniations. There are 3 phases of disc degeneration. The first phase is when you begin to notice dehydration of the fibers with some cracking and separation. The fibers become weak, resulting in spinal instability and bulging of the disc. Phase 2 exists when the fibers continue to dehydrate, degenerate, and tear. This allows the center gel material called the nucleus to seep out. This material works its way towards the periphery, causing a herniation. Phase 3 occurs when these fibers have all but completely degenerated. This is the last stage of degeneration. This phase is most common in patients that have spinal stenosis, a condition of which there is so little room for the nerves that pain is generated with any prolonged walking. The effects on the nerves. Normal spinal nerves look healthy and provide for normal function along the course of the nerve. All the tissues, organs, and glands supplied by these nerves function normally. As the disc degenerates, the nerve opening slowly shrinks in size. The nerve will accommodate this by also shrinking in size. If the disc degeneration happens slow enough, you may have little or no symptoms. However, you may have pain, which gradually goes away. The reason it goes away is the nerve is adapting. It is shrinking to fit through the restricted space it has. However, if there is a rapid change like a herniation from a trauma, you may experience severe, sudden onset of pain which does not go away. You will also experience prolonged pain when the level of herniation or degeneration is such that the nerve cannot shrink or adapt any further. It is very common to experience a rapid onset of pain from little or no aggravating event, for the disc can dehydrate, slowly degenerate, and even herniate without warning. Then, all of a sudden, that one day symptoms appear, for there is no longer enough room for the nerve to exit the spine unimpeded. Symptoms show up for your body has reached its limit for adaptation. I hear this every day. A patient will proclaim that they never experienced any previous back symptoms. Then all of a sudden, severe pain began, without warning. How treatment helps you adapt to degeneration. One of the most difficult truths to accept is that most of the treatment provided patients simply helps them to adapt to the degenerative changes. They do not stop or even slow the progression of disc degeneration. These treatments include medication, cortisone injections, epidurals, massage, and even physical therapy. Pain medications have been proven to make your condition worse. They cause muscle, ligament, tendon, and even nerve damage. And worst of all, they are quite deadly. Did you know that there are over 2,000 deaths a year from one of the so-called safest medications on the market today, that being aspirin? And if that is not bad enough, NSAIDs, which include medications like Advil and Aleve, cause as many deaths a year as the disease AIDS. For there are over 15,000 deaths a year from non-steroidal anti-inflammatory drugs. Really? As a holistic physician, if I were to recommend a supplement and even one person died over the last 50 years, it would be front page news. However, Big Pharma and the American Medical Association's monopoly, with the collusion of the media, have been successful keeping patients in the dark about this fact. Drugs kill while providing no actual benefit at all for the degenerative disc condition. The complications get worse as the medication gets stronger. How about cortisone injections? The side effects of cortisone are numerous and include death of the nearby bone, called osteonecrosis, joint infections, nerve damage, skin and soft tissue thinning around the injection site, temporary flare of pain and inflammation in the joint, tendon weakening or rupture, thinning of the nearby bone or osteoporosis. Cortisone actually makes your condition worse. A good way of understanding the ineffectiveness of medication is to consider a more obvious situation. Let's see if I can help you really understand the absurdity of most treatments. Imagine, if you will, that you had stepped on a nail and it was sticking through your foot. The scenario I'm going to cover with you is just like having a herniated disc. It is much easier to understand, for unlike your disc, you can see and understand the problem. So your first step is to go to your doctor. And to your surprise, he suggests you take a medication, the painkiller of your choice. This is similar to what he would suggest for back pain or neck pain, right? Well, you would obviously object and request that the doctor fix the problem, remove the nail. He refuses. For you are a simple patient. What do you know about medicine? He tells you to give the medication a try. You return to your doctor a week later, continuing to complain of the pain. His next stage intervention is cortisone shots. Once again, you object, insisting he get to the real underlying cause of your pain, that being the nail. He persists and attempts to convince you that cortisone is good for you and the correct treatment. Without surprise to you, the pain from the nail continues. For no reason other than your insurance covers this doctor, you return a week later complaining the pain is even worse. And you beg him to please fix the real problem. Remove the cause of the pain. His response is to send you to a surgeon to have the ends of the nail that are sticking out cut off. Really, you think? That is the best we have to offer? Relentless treatment of the symptoms? No focus on the underlying cause? The only difference in the aforementioned example is your problem is a disc, not a nail. Since the disc lies deep within your body, you may have difficulty understanding the complexities of the problem. However, this is precisely the problem. Since most patients do not understand the disc, they do not relate to how the treatment provided is wrong. Pain medications, cortisone, and epidurals, and eventually surgery to cut off the part of the disc that is sticking out is not going to fix the problem. These treatments are only focusing on the symptoms. The proof is in their studies. These are not my studies or those of holistic physicians or any other alternative medicine group. I am reporting on what medicine has said about what medicine does. They prove themselves wrong, ignore their own studies, and keep on doing what they have proven does not work. In a review of nearly 24 clinical studies involving thousands of patients, researchers found that epidural corticosteroid injections had no long-term effect on back pain and only a short-term effect on leg pain. Researchers from Johns Hopkins University evaluated 84 patients to determine whether epidural steroids, Enbrel, or saline placebo better improves pain and function in adults with lumbosacral radiculopathy. Pain resulting from inflammation and or impingement of the nerve roots in the area of the lumbar or sacral vertebra. 1 month after receiving the second epidural injection, the researchers found that patients taking steroids reported less pain and disability compared to patients on Enbrel or placebo. However, after 6 months, slightly more patients in the saline and Enbrel groups reported less pain than those taking steroids. So the takeaway from this study is that saline, yes, saline, which is equivalent to doing nothing or injecting nothing into the body, is as effective as any of their medications. Saline was provided in the control as a sham. In other words, saline was the equivalent of doing nothing. So doing nothing works as well as the medications. Research suggests that of the 500,000 plus disc surgeries performed annually, as many as 90% are unnecessary and ineffective. The reference for this, the researcher is Finnison, and the title is A Lumbar Disc Surgery Predictive Scorecard, a retrospective evaluation published in the Spine Journal. That is a 90% failure rate. If the treatments I provided were 90% unsuccessful, I would be thrown out of town. I don't get it. How do they manage to keep getting patients? The obvious answer is they have a monopoly. To begin with, it is like a good old boys club. Like referring to like, medical physicians referring to medical physicians. If you don't agree with what they are doing, well, you won't see any referrals, will you? All of my patients come to my office as a result of referrals. Not a referral from a medical physician, though, but a referral from another patient who has had good results. Another way they keep getting patients is insurance coverage. Medicine is the primary coverage provided by health insurance industry. Another way they keep getting patients is the advertising support provided by pharmaceutical companies, or what I call big pharma. No one advertises for me. No vitamin, herbal, homeopathic, or equipment companies on my side. My only advertisers are you, the patients. What treatments work? You may decide to get a massage. Massage is wonderful. However, it is not going to heal a degenerated or herniated disc. Physical therapy, including stretching and exercising, is a great idea also. However, unfortunately, it's not going to heal a herniated disc either. How about the infamous inversion tables people are hanging themselves upside down on? A study published in the Archives of Physical Medicine and Rehabilitation looked at the effects of inversion therapy on 20 patients with low back pain. Researchers found the inverted position raised both systolic and diastolic blood pressure, induced headaches, blurred vision, and contact lens discomfort in many of the patients. The effects on blood pressure could increase your risk of a stroke. If you have certain health conditions, inversion tables could prove outright dangerous. The increased pressure in the eye region could complicate glaucoma, diabetic retinopathy, cataracts, and infections of the eye. Do not use if you have hypertension or any kind of heart or circulatory condition. Conditions affecting your bones such as osteoporosis, skeletal implants, or even recent fractures can make inversion therapy harmful. Other contraindications include pregnancy, obesity, hernia, and the use of blood-thinning medications. So you must be wondering, herniated disc, degenerated disc can heal, right? The key to resolving a degenerated and herniated disc is to realize that your condition exists because of your unique underlying imbalances. These include physical, chemical, and energy or meridian imbalances. Dr. Schneider's approach to resolving disc problems is individualized care with a comprehensive approach. He will discover your unique underlying cause for the disc problem and apply a customized, personalized, and comprehensive treatment. He will discover and get to the root of your disc problem. He will develop a program to help you heal. First off, he will do an exam to discover what physical imbalances exist. He will have you fill out a health history and a symptom survey in order to discover your physiologic, chemical, or nutritional inadequacies. He will do an electromeridian analysis to determine the imbalances within the meridians and acupuncture system. Dr. Schneider may recommend X-rays, MRI, or other tests to accurately diagnose the underlying cause of your condition. Dr. Schneider utilizes a large array of therapies to help correct your condition. He may suggest flexion distraction in order to restore normal motion and function to the specific damaged disc, improve ligament and muscle health, and correct bony structure, function, and alignment. Alright, so I want to go over what flexion distraction does and how it affects your disc. So this is flexion distraction, this is the table, and so you can see as I'm putting a little bit of pressure on the spine here and the table's moving up and down. The effects this has on you is it separates the joints, it pulls fluid and nutrition into the disc, and it creates a little bit of a vacuum pulling the disc back in. So I'm going to show an example of this bone here, and as the table is dropping down and I'm putting pressure on this bone, you can see what happens by looking at this model. So we're opening up the disc and closing it, and that actually creates a vacuum inside the disc and pulls the disc back inside, pulls a herniation back inside. He may suggest spine med decompression therapy. Unlike standard motorized traction or inversion therapy, spine med therapy gently lengthens and decompresses the damaged disc following a computerized algorithm, which creates a negative pressure inside the disc. This reversal of pressure creates a vacuum inside the disc and helps restore the pump mechanism of the disc, which can also reposition bulging and herniated discs and pulls the disc material back into place, taking pressure off the pinched nerves. Nutrients, oxygen, water, and fluids are drawn into the disc to create a revitalized environment conducive to healing. Common ordinary traction cannot do this. He may suggest acupuncture in order to accelerate the overall healing and specifically to accelerate restoration of nerve function. For as a disc degenerates, bulges, and herniates, the nerve will shrink, atrophy, and as a result, decrease function and increase pain. Dr. Schneider has been trained in specific acupuncture techniques to enhance the function of the nerve, resolving symptoms faster. Your condition may have existed for many years. In such cases, chronic muscle tightness, inflammation, adhesions, and scar tissue may have developed. If you have ever tried to chew through gristle while eating a steak, this helps you understand the condition that can exist within the muscles. This type of tissue can develop along the course of the nerve and attach all the way down to the disc. It may be necessary to address this tissue in order to resolve your disc condition. Dr. Schneider may suggest a technique called Graston to do just that. It incorporates the use of tools in a deep tissue massage-like approach. However, it is much more specific and targeted therapy. Dr. Schneider is trained in applied kinesiology. This approach relates the importance of muscle function to balance, and it interrelates acupuncture and nutrition in order to create optimal function and healing within your body. This is an important therapy Dr. Schneider will be utilizing throughout your care. Dr. Schneider has a degree in nutrition and additional training in functional medicine. He realizes the importance of diet and nutrition. Each case is different, and Dr. Schneider will advise you accordingly. There are different levels of care. It is important for a patient to be educated and be in charge of their health and healthcare decisions. There are 3 types of care you will have to decide upon: relief care, stabilization care, and corrective care. The first option is to receive relief or symptomatic care for these aforementioned conditions. If you choose this option, your treatment frequency should be at 3 times a week until you are happy with your symptom reduction. The second option is stabilization care. If you choose this option, your treatment frequency will need to be 3 times a week for 12 weeks. The objective of this level of care is to not only get you out of pain, but to also improve upon the health of the spine and the disc. The third option is corrective care. If you choose this option, based on the severity of your condition, it is recommended 1 treatment per week after the completion of stabilization care. This time next year, we will reorder new x-rays to determine how far you have come. At that time, we will discuss future options. You have a choice. You can decide to focus on restoration of health, healing your disc, or you can choose to ignore the message your body is providing you. You can cover up the symptoms. Tell your body to be quiet. You don't want to hear it. You could choose medications, injections, and surgery. You can go around negative, worried, expecting the worst. I hear people say, I am afraid. I'm too bad off. I am afraid I will never get rid of this pain. I am afraid I'm going to have surgery. No, that is not true. They simply do not realize it. They have been brainwashed by Big Pharma, the American Medical Association monopoly, the prejudice of the insurance industry, and the cover-up of the media complex. They have been conditioned to live in fear. They have been programmed to do whatsoever the insurance company okays, except whatever the medical monopoly provides. Take whatever the pharmaceutical company advertises and believe whatever the talking heads on television say. However, you can choose to break free of those shackles. You can choose a new path for your future. You can put your faith in the ability of your body to heal. You can do the right thing. You can realize that the best days are still out in front of you. Here is the key. Whatever you focus on is going to take root. If you focus on covering up your symptoms, drugging your body, cutting it apart and altering it, you will reap that outcome. If you go around doing things that have side effects and cause harm, then you are inviting poor health into your life. However, if you focus on the root of the problem, if you focus on nourishing, healing, and restoration, then you are inviting health and victory into your life. Use your faith in the right direction. If you are ready to take the next step, you may wish to hear a couple of patients like yourself and how they responded to treatment. Okay, hi, this is Lisa Zubko. She got into the office with an L4 disc herniation, and she also was suffering with right and left knee degenerative joint problems. I'm going to let Lisa tell you a little bit about how she came here, what kind of symptoms she had, and how she's doing now.
Yeah, last October I started having pain in my right groin, and it got so bad my leg was giving out, and I actually fell at home a few times. My husband went out and got me a walker just so I could get from the couch to the bathroom and back. I had never gone to a chiropractor before. I looked in my network to see who there was, and there was a couple names, and I picked Dr. Schneider, and I am so glad I did. Because within a couple of weeks I was walking. I mean, I still had pain, but now I went from like an 8 pain level, now maybe 1 or 2.
And then your knees also.
And my knees are great. Once in a great while they might twinge a little, but...
So that's a good story. It just shows, how conservative care, herniated disc, no surgery, and it works.
No surgery.
Yep. All right. Thank you.
Alrighty.
This is Jane and Bob Dixon. They're patients of ours. Jane is 83.
83.
Bob is
90.
90. And Jane and Bob came to us a couple years ago, and Bob actually came in with 16 herniated discs with quite a bit of problems. Jane came in actually before Bob with 3 herniated discs. And when I saw Jane, I told her, Jane, you're one of the worst patients I've seen with the severity of your disc condition. Well, so she thought she would refer Bob in so that she wasn't the worst patient we'd ever seen. And they've been coming in for a few years, and I thought I'd let them just say how they're doing and how it's helped them through the years.
Okay, as for me, I was sleeping on the couch, couldn't sleep in the bed because my back hurt so bad until I came here, and I have no pain. I'm fine. I'm walking every day. Everything's good. Come in twice a week. And
how about you, Bob?
Oh, I always said I was in good shape. I think my wife got me to come along, and it's improved, and I can walk now a longer distance, and I'm improving.
We just got to keep you walking for longer.
Okay.
Very good.